So we move on to the last presentation for today. So Adnan, are you ready?
Yes, thank you so much. Let me put on, get my slides up.
Yeah, I have to shut down my slides. Yeah, stop share. Done.
So Purikit, there are questions from others. You can take a look at the chat.
Sure, I'll look at it. And I'm hanging around, so I'll keep this time in the end, I think.
Okay, thank you. So can everyone see the slides?
Yes.
Okay, great. So yeah, I think we've had great presentations already, and I'll be more sort of looking at the COVID-19 response and looking at the state capacity, structure, and also the policy with a focus on more short to medium term kind of implications and a little bit about the long term as well at the end of this. So just to give a snapshot, Pakistan, as with other South Asian countries, the numbers are increasing both in terms of the number of deaths and also the COVID-19 positive cases. And it seems to be on an upward trajectory despite the lockdown that has been in force, though partially, it hasn't been a very strict lockdown, but it's been 6 weeks and that may have resulted in slowing down the spread of the disease a little bit, but it has certainly, it's still on an upward trajectory. And now we are at a point when I think the appetite for any further lockdowns is dwindling, and so we can expect even more increase in the numbers in the next few weeks. So looking at the state capacity to deal with such a pandemic, I think all of the health indicators that we have from Pakistan are really abysmal. The government expenditure on health is just under 1% of GDP. Almost all of the indicators, as you can see, are below the WHO's guidelines. There is less than 1 doctor per 1,000 citizens and so on and so forth. One of the biggest problem also is the private sector. I mean, it seems that the healthcare was almost left to the private sector and out of the pocket expenses, contributed to 64% of the all healthcare expenditure in the country. Now, that also means that it was very much driven by the market. So there are huge disparities in terms of the provision of healthcare facilities, particularly the diagnostic facilities when it comes to urban and rural areas. So more peripheral areas have very little health facilities compared to more bigger urban centers. Also, private healthcare was loosely regulated. There are large segments of the society who rely on spiritual healers, hakims, and other sort of non-trained medical practitioners. Therefore, there is a huge health risk that is at hand, and I think that would be true for many other developing countries. Where Pakistan was slightly better prepared compared to many other developing countries was its social protection and social safety net programs. In 2008, Pakistan started the Benazir Income Support Program, one of the largest cash transfer programs in the world. And through a national survey, household survey, which covered 87% of the population, a national poverty scorecard was developed, which was then used to provide targeted support through cash transfers to millions of people. Now, since this pandemic started, the number of beneficiaries of the Benazir Income Support Program, which is now called Ehsaas Program, have increased, and around 12 million people were given around 12,000 rupees, a cash injection of 12,000 rupees in the last 2 months. And this amounts to roughly about $1 billion in monetary terms. Now, there has been criticism in terms of the mechanism that has been adopted to hand this money out, because generally the handouts, the cash transfers were administered through the bank cards, the ATM cards, but because this had to be expanded and the additional people who are supposed to get this cash handouts, they didn't have the cards and bank accounts even ready for this. So on a lot of instances, they were sort of queued up and they were given cash, which obviously has its own problems. Nevertheless, I think that did help, to large number of households in Pakistan in terms of immediate support when it comes to social protection, some sort of social protection assistance. Then I'll come to some other incentives as well that were offered to the business sector, particularly the SMEs were offered 3 months of electricity bills that will be paid by the government. There were other incentives for the construction construction sector, where some of the taxes were waived, and the exporters were given some incentives through, some subsidies on the export orders, and they were allowed to continue work despite the lockdown. But, how is all this decision making being done? And in there, I think Pakistan over the years, especially since 2010, when the 18th Amendment to the Constitution came into play, has a very decentralized and sort of a devolved governance structure. The provinces are now solely responsible for health, education, and policing, along with many other things. However, the border control, aviation, armed forces, foreign policies, these are all under the federal government's control. So this created a lot of coordination problems at the initial stages when the provinces were following a different strategy and the center had different things in mind. Also, Pakistan is known to have the civil-military divide, although the current government is working very closely with the military, and they've set up mechanisms to ensure collective decision making. Generally, there has been a rift along those lines. Lastly, in the civil society as well, there are powerful interest groups. There's the business industrial elite. There are various. There's an ethnic mix that has to be considered, and there is a very strong religious lobby, which has all come into play in terms of shaping policy on COVID-19. Lastly, the bureaucratic structure, like many other developing countries, is really rooted in the colonial model, and has absolutely no capacity for evidence-based decision making and so on. So there are structural weaknesses when it comes to states' capacity to deliver or execute any policy that it comes up with. The last point on this side was the setting up of National Coordination Committee, which brings together the provincial chiefs, the military, the health officials, and the federal government all on one table, that has been primarily been responsible for strategic decision making in this regard. And this was actually set up on 12th of March, which was actually even before the first COVID-19 case emerged in Pakistan, which was 26th of March, by the way. So, some structures were put in place. Nevertheless, when we actually come to the policy response, we see a divergence of approaches between particularly the Sindh government and the federal government. Now, Sindh is ruled by Pakistan People's Party, which has been way more stricter in terms of enforcing the lockdowns and in terms of, and this has boiled down to this lives versus livelihoods debate, where the federal government led by Prime Minister has been more worried about protecting the livelihoods and the daily wagers and laborers, whereas and economy, and Sindh has been more focused on saving lives and enforcing more strict lockdowns. Now, this has resulted in a number of public debates on key policy issues in terms of whether to keep the mosques open or not, or under what SOPs can mosques operate. there has been huge pressure from the religious community on that, whether to, have railways or public transport working or not, and so on and so forth. When it comes to economic projections, World Bank and IMF have come up with quite alarming projections for Pakistan economy. Already the economic growth was on a downward trajectory. We were expecting around 2.5% economic growth, but the current projections seem to show that there can be a recession. So Pakistan can register a negative economic growth potentially. So, and rest of the issues mentioned by the first presenter and the both presenters, actually, they very much apply to Pakistan. So as I was listening to them, I could very well imagine that, all of that is sort of applicable to Pakistan as well. The last point I want to make on the government response is that for the reasons I've mentioned, there is lack on clarity on the policy objective, whether it is, or if it ever was, to eliminate coronavirus from Pakistan along the lines that South Korea and the New Zealand and these countries were trying to do, or was the policy objective just to flatten the curve so that we don't overwhelm the health infrastructure to deal with the cases. And where do we stand today? And it appears that, the latest situation is when the economy is being opened in phases and the lockdowns are being relaxed and all, it appears that, the livelihood concerns or the economic concerns have triumphed. And so, the priority now is to put people back to work and then deal with whatever happens on the disease front. And I think what was also disappointing was the lack of testing. I mean, Pakistan has one of the lowest numbers of tests being done globally. I mean, right now, there have been in the last month 6,000 to 7,000 tests in all of the country per day, which comes out to be something around 960 tests per million population, which is very low. Just for comparison,
5 minutes.
Okay, just as a comparison, South Korea did 12,000 tests per million of a population. And that's even worse, as I say, when you look at the urban-rural disparity. So for example, when you look at Islamabad, the ratio is around 5,000 tests per million population. But when you look at Khyber Pakhtunkhwa province, that drops down to something like 500 per million population. So that means that the data is really not reliable. And so whatever policy is based on that data is really questionable. Lastly, what is helping? I mean, I think some of the response from the international community, rescheduling foreign debt, that has provided some fiscal space to Pakistan, and Pakistan is still in talks with some of the other benefactors that it has, China, Saudi Arabia, and so on, for more rescheduling of that. Also, Pakistan is looking towards international community for ventilators, antiviral drugs, etc., etc. In terms of state response, it's been mostly through cash transfers. There has been very little sort of in-kind sort of, food deliveries or other sort of in-kind help. But the civil society has activated itself through the charity networks, through NGOs, where more of the in-kind delivery is being done. A lot of people are more dependent on their social networks, on their extended families at this hour of need and so on. And I think that the government will have to rely on the rural sport networks that exist in Pakistan and other large NGOs like ED Foundation, for example, which has taken the bulk of ambulance service, sort of facility and so on. In terms of mid to long-term economic sort of outlook, I think we need a major sort of rethink of the way economics is managed worldwide. I mean, Pakistan, before the pandemic was on an IMF program where it was all about belt tightening and austerity. And now all of a sudden, that isn't possible. So Pakistan, and I think many countries worldwide, will have to the public sector will have to be the primary engine for economic growth, for creating jobs, for, giving people subsistence and so on and so forth. And how will public sector be able to do that? I mean, that will mean some major sort of revisions of the thinking or the logic behind our economic management. So I can for me, I think the public sector programs will have to be developed. The manufacturing and SME sectors will have to be prioritized rather than giving huge cash injections to the big industrialists and wait for the trickle down. I think the government will have to better target its interventions to those at the bottom of the pyramid. And also, more importantly, where are the laborers in all of this economic decision making? They are completely missing. So the labor representatives will have to be involved. There will have to be debate about formalization of economy, of enforcing the labor laws, of providing better job security when it comes to private sector, and so on. And also in terms of delivering a lot of public services, the role of local bodies, I think, is essential and has been missing. I think the early report suggests that where in Sindh, for example, where Pakistan do have local bodies, it has been much more effective to provide and coordinate sport at the local level, even if it was to better enforce lockdowns. And where we didn't have local bodies and it was all down to the district administration, there were bigger problems because it's only so much that the district administration can do. So these were some of the thoughts and the overview of the situation. And if there are any questions, I'll be happy to take them.
Thank you. Thank you, Adnan. There are some questions for you. Rinchan, would you like to start off?
I was just wondering whether, so you just mentioned the 18th Amendment and the devolution that has resulted from that. That seems to suggest to me that local governments probably would have played a more prominent role in especially the provision of, any kind of in-kind or cash transfers that the Pakistani government is trying to do because of COVID-19. So is there any evidence that local governments were involved in any of these transfers? And also another related point is you mentioned the kind of, the difference, the heterogeneous response to COVID-19 between the Sindh government, which is the provincial government, and the federal government. Has this resulted in differences also in the level of support that's been provided across the different provinces? So in terms of, one would expect that a province that implements a lockdown in a more severe fashion would also be providing a higher level of support to its population because their economic activity would be strangled, further. So have you also, is there any evidence, even anecdotal, which suggests that, for instance, Sindh or other provinces which might have imposed a lockdown in a more severe manner are actually providing more support?
Yeah, so first the devolution under 18th Amendment has been about transfer of powers from the center to the provinces. And then, from provinces to districts was really left to the provinces. And that has not happened uniformly across all provinces in the country. So Sindh has slightly better local bodies, but the other provinces, actually Punjab and KP, do not have functioning local bodies at all as we speak. So therefore the role of local bodies has been rather limited in respect of any cash assistance or social protection. I think the social protection still remains federal government's sort of purview, and therefore the Benazir Income Support Program or the Asas program, which roughly amounts to around 0.8% of the GDP, has been the key instrument. But the provinces did not have the fiscal space or do not have schemes where they can do such large-scale social protection programs. The provincial response has focused more along the coordination between the health and the police authorities, so that they can deal with the patients and the policing requirements in terms of social distancing guidelines that were implemented and so on. And therefore because social protection has been centrally sort of organized and managed, it has been fairly uniform across the provinces, irrespective of the level of lockdowns in those. Your second question was about, sorry, I forgot your second question.
It is about differences in response, but there are other questions. If you can, answer those.
Okay. So there's a question from Arno.
Hi, can you hear me?
Yeah.
Okay. Hi, Adnan. I think thank you for the sort of rich sort of context of all the different activities. But if you, just to think of this in terms of a priority structure, what would you think would be of most interest from a recovery and response perspective from all the different suggestions that you had?
So I think in the immediate aftermath, what was really required was a strict lockdown accompanied with massive testing. Now, because testing did not happen, the lockdown, in my view, was not very effective. We still are unable to identify the hotspot and the clusters. And therefore, now when we open up, we have no idea how the disease is distributed within the country. So we have missed the boat, I think, on that front. So now I think obviously a strict lockdown could not be sustained any longer than perhaps 2 months. And we've missed that opportunity. And now I think, and also along with those two things was this immediate cash transfer and the immediate relief. So I think dispersing close to $1 billion through SARS program, I think was a very, very effective initiative. But as we move forward, I think again, testing will be the key, because we would still like to be on top of identifying and isolating people who are catching the infection. And due to our peculiar demographics, if it actually spreads, because now it has actually become a class thing in a way, because myself and you can perhaps still telework and still remain confined in our houses and still work. But those who have to go out of their homes, they're taking a huge risk in terms of their health. So how do we protect them through massive community testing? That seems to be the only way. So that is one thing. And second, how SOPs can be enforced at the workplace. How can, to protect people, that's second. And in terms of economics, again, the budget is sort of, a few weeks away. That will tell us a lot about government priorities in terms of how they want to, deal with the economic crisis. And I think a lot of reprioritization has to take place in terms of what kind of development are we looking at in terms of, non-development or non-productive spending that we've had. South Asia has huge militaries. Just look at the military budgets of India, Pakistan, Bangladesh. Are they still feasible in the current environment that we are in? Again, the budget will tell us a lot. And I think these are some of the key questions that we'll have to grapple with.
Thank you, Adnan. There's one more question from you, for you, and then we sort of open up the floor for all the previous. So all the three speakers would get questions and so on.
Is it the one? Is it the one?
Penelope, please go ahead.
Well, yes. Thank you very much. I really enjoyed your presentation as well. Extremely informative about the situation in Pakistan. I'm interested to know, following up your latest comments, if there is already taking place a discussion about how there is going to be a shift between the provision of the healthcare from the one that has been, I don't know if it's delivered or not, but shifted to the private sector to bring it back to the public sector because it is imperative. I mean, most of these people, the poor ones I'm referring to, the ones that are really just trying to get some food, which, I mean, you describe the options that people go to, but is there a formal discussion of how this is going to go ahead?
Yes, I think there has been a lot of concerns about, the healthcare sector in general, especially the role of private healthcare, because there have been, most of the private healthcare facilities did not accept COVID-19 patients. That was first. Then the labs that were privately offering COVID-19 tests, they were very expensive and sort of exploitative. And there has been, a very clear understanding developing that without a very strong public health mechanism and system, pandemics like these or other health shocks can absolutely not be dealt with. And Prime Minister has mentioned a few times that this is an opportunity for Pakistan to revamp its public health sector. It has been taken up for the first time. The National Security Committee held a meeting on the, on the state of readiness of the health sector, and the top health officials are obviously at the center of all of coordinating and recommending initiatives to respond to this. So one can certainly hope that there will be a rethink with regards to prioritizing health as many things go in Pakistan. We look at everything through a security prism, and when health pandemic is dubbed as a potential risk to human security or national security, then it means that someone is serious about looking at the health sector for the future. But that will have to be seen.
Honorable, may I come in on this point just for a couple of minutes?
Yeah, please.
This private versus public. So there are lots of reports which are coming out in Indian newspapers where private hospitals which are not taking COVID patients, just as Adnan was saying, but obviously you can't screen very well, right? So eventually somebody is found, and then the doctors and nurses are infected, and the whole hospital is getting shut down, right? So the balance between the private and public hospitals is very much skewed towards the private hospitals, right? I think 70 to 80% of the beds, something in that region, is in private hospitals. But the COVID initiative is largely happening to the public hospitals, right? So all the PPEs, all the protective gear, etc., I guess is getting more towards the public hospitals, and private hospitals are just getting shut down because of they can't completely quarantine themselves. So that's a massive potential risk as far as treatment of other diseases is concerned. And so there's a long-term problem here. I think we have to think about the entire healthcare systems, a balance between public and private healthcare, the sort of American style insurance model versus universal publicly funded healthcare. So those are long-term issues which we have to think about. But right now, as things are happening, there's a serious coordination issue between, these two segments, private versus public healthcare. And the COVID initiative cannot be restricted only to the public hospital system. Somehow the private hospital, their resources has to be brought in, and they also have to be shielded from the COVID risks, which is not happening. I mean, it's kind of getting contaminated, and entire hospitals are getting shut down.
And may I just add, added to that is the question about, how does this kind of reintroduction of the public sector into health provision take place? Does the government simply purchase these private hospitals, or does it do like a public-private partnership with these private hospitals and ensures that a certain level of healthcare delivery is maintained to all segments of the population regardless of their purchasing power? Or does it, provide, go down the route of insurance, providing, massively subsidized health insurance, so on and so forth. So these are all, I hope these are all ideas and issues that will come up because of this COVID-19 pandemic. Unfortunately, it took a pandemic for us to, try and think about these kind of issues. But I certainly think those are all issues that I hope will be discussed now.
And it's still a hope, even with the pandemic.
It's still a hope, unfortunately.
Yeah.
So very quickly, I think Pakistan over the last 5 years did take initial steps in terms of setting up a national health insurance sort of model where the government offered it to public sector employees, and increasingly, you know, the concept was gaining ground in private sector as well. So that might be one way. But having said that, right now in the middle of this crisis, I think there is a sense that if the public sector does get overwhelmed and there are no beds available anymore or no ventilators available anymore, then the government may, you know, I did get a sense from the district administration in my own hometown where I, visited the main district hospital and the district administration, and they were absolutely clear that they will, in one way or another, get the private hospitals in the town sort of involved. And they were saying there were legal provisions to do that. So, yeah.
Okay, excellent. Fahmida, any last comments before we sort of wind up? We can't hear you.
Right. Sorry, I didn't unmute. Right. So I think, like other South Asian countries, Bangladesh has to really struggle for the next 2-3 years to regain the economic losses. And as we have seen in the presentation, that these losses will be different from the previous ones. Previous economic shocks were of different nature. And but right now, I mean, the issue is that how to keep the poor people, fed, and how to reach out to them with necessary support. That this is the issue, main issue. But Bangladesh is in an advantageous situation compared to some other countries in the sense that we have a lot of non-government organizations which are working across the country. So apart from government support, those NGOs are also working. They're providing microcredit, they're giving loans, and which is creating employment and also contributing to gender empowerment. And that fund is also not negligible. This is one, but during the crisis like this, it has always, not like this. I mean, during crisis in a couple of years back, we had Ayla, flood, Sidor, all these. During crisis of those, these organizations play a vital role in reaching out to them, because those are the organizations which know exactly what is the status of the people who are poor, actually poor, who are genuinely in need of the support. So this demand a collaboration of government, private sector, and non-government organizations' activities towards the recovery of the economy, right now, in the immediate term, and also in the medium term.